Hey, Sarah.
Hi, Megan. How are you?
Oh, I am good. I'm good. We are getting ready for a trip to Disneyland, and
Yay.
I know I'm excited, but I'm also a little fearful because we just had RSV and COVID rip through my family at the same time. And just to
I'm so
clarify,
sorry.
I know I do think my husband and I had like co-infections of both. We had both illnesses at the same time, which is crazy. And this is my second time catching COVID in 2 months after
And
being a
you
Novid.
had gone 3 years without getting it, almost
Yeah,
four.
I'd been a Novid for almost 4 years, and now I've caught it twice in the span of 2 months, which is
Oh my gosh.
crazy. But because we've just had COVID, I'm going to be that crazy lady at Disneyland wiping down every single ride that we go on. You're welcome, Disney, for cleaning your
Yes.
rides. I bought, I think, 12 packages of the individual size Clorox
Wipes.
wipes, and I'm going to be wiping everything down.
Oh
Everything.
my gosh. Oh
I
my
know.
gosh. I
I
cannot
know.
believe you got it back to back and with
I know.
another illness that's in it's like unheard of. I'm so sorry you guys
Unheard
went through
of.
that.
Thanks. Yeah, we're getting through it. We're on the other side of it at this point, but
Oh
it's
my
been a doozy
gosh.
of a fall. I'll say that. So,
I'm sorry.
yeah, thanks.
Speaking of Disney, I meant to text you when I saw this in the news and I forgot. But how about that guy that was like climbing through It's a Small World naked recently? Like, oh my God.
I saw that. That was absolutely crazy. I think I read he was on drugs or something like that, but he got
Yeah,
naked and
you
was like,
think?
yeah, or had some sort of a mental break of some sort. But he was running around the ride completely naked. I can't imagine being on the ride with my kids and seeing something like that.
Oh my God, no, right? I was like, this is insane. Although I watched the video and I was like, he didn't look scary to me. Like, I don't know that I would have been scared. He was just
Yeah.
very odd. Like, he was like crouched down next to the little, like, people from the different countries and he was kind of like moving back and forth with them. I'm like, well, that's weird.
That's
Like,
super
it's
weird.
like an acid trip gone wrong.
Yeah. Oh my
Oh my
gosh.
God.
So
It's
crazy.
so embarrassing for him. Like, what if he's
I
just a
know.
totally normal guy who took like a bad dose of drugs and now he has
I
to look back? Well,
forever.
he
It's
probably was arrested.
Oh yeah, I think he was arrested. What's really weird and funny, but also just like weird, the amount of I don't know, the weird behavior that you witness at Disney sometimes. Like people take videos of like straight up street brawls occurring, in the middle of Toontown and things like that. And it's like, what causes I think it's a high stress environment and may push some people over the edge.
Maybe.
But there's a lot of strange incidents that occur at Disney, but on both coasts.
That's so
So
weird.
I
But Florida
know.
more, right? No, I'm just kidding.
Potentially.
I'm just
Yeah.
kidding.
Disney needs to hire a psychologist like me to go through just screening people
Yes.
and saying, "Do you need some help? I can be of
I
service." But
know. Oh my God.
mm,
Such a crazy thing.
yeah.
Wow.
That's so.
Um, well, with that, I'm excited for today. Welcome everyone to Platinum Perspective, the podcast about beauty, travel, psychology, luxury, and more. I'm your co-host, Sarah.
And I'm Megan. Sarah and I are best friends who put the work in to get the most out of life so you don't have to.
Today, we are diving into a topic that I requested. So join us for another one of my sessions with Dr. Megan. No.
Aw.
So today we're going to talk about perfectionism. So when Megan and I first met, probably within like a month of meeting, we were going on just bringing everybody up to speed. We were going on like walks a couple times a week because we
Mhm.
did school drop off and then we had our little girls with us. And I remember you said in like the most eloquent and the nicest way, like during a conversation on this walk, you said like kind of nonchalantly, well, I would categorize you or diagnose you with perfectionism. And you were so kind to align with me. So you said I have it a bit as well. And I'm so happy you told me that. I'm a little embarrassed to say it never occurred to me. Prior to that moment, it had never occurred to me that I would have never called myself a perfectionist. Like I always kind of joke about like the oldest daughter syndrome. Like
Yeah.
you're like the oldest daughter, you're super efficient and high achieving and working really hard towards things. And I kind of just thought it was that. But we still stayed friends.
Sorry. I know to go ahead and diagnose you after just meeting you after a month. Well, and to be fair, that's not a diagnosis. It's also not always a bad thing. But it's something to be aware of. And so I
Yeah.
just wanted to point that out to you at the time. And I think I was trying to get you to give yourself some grace, as I recall.
Yes. You were. No, I'm
Yeah.
joking. I really appreciate it. I'm always looking for self-improvement. So having somebody else's perspective, especially you and especially as psychologists, it's really valuable to help improve. Although as I'm saying this, I'm like, it's a perfectionist tendency right here.
To try to always improve.
to
Yes,
try,
it is.
to try to constantly become better. No,
Yeah.
oh, we're getting in deep already. No,
Oh, yeah.
but thank you for honoring my request. So I
Sure.
had wanted to do an episode on perfectionism because it's going to hit really close to home, and I just genuinely have a lot of questions around it to help better myself. No, I'm just kidding.
Okay. Great.
Yeah. Okay. So before we get into the episode, I have a few rapid fire questions. Are you ready?
Okay. I'm ready.
Okay. First one. Is perfectionism a learned trait or is it genetic?
It's both, but I would say it tends more towards genetic.
Oh, okay. So I can blame my mom.
Yes. Blame your genes.
Okay. Is perfectionism helpful or harmful to personal growth?
Again, both. And we'll dive more into that in the episode, I think.
Okay.
Yeah.
Number 3, is perfectionism common?
The short answer to that is no. It's a dimensional trait. So whoever is at the top end of that, that's not common to be
Mm.
very, very perfectionistic. But I'll say it exists along a continuum. So it's not necessarily yes or no.
Mhm. So I'm the best in the bell curve. No. Okay.
Potentially, yes.
Okay. Okay. Last one. What is the top sign that you might have an issue with perfectionism?
If you never feel feelings of success, I would
Oh,
say you're dealing with some perfectionism. If nothing's
okay.
ever good enough,
Oh,
that'd
okay.
be a good way to know.
Okay. Good to know. Good to know. Okay. So let's start the episode, if you don't mind, by defining perfectionism. What, in your words, is perfectionism and how does it show up for you in your clinical practice?
Sure, yeah. So perfectionism is a personality trait that's characterized by a relentless pursuit of being flawless, setting exceedingly high expectations and standards for oneself. While having high standards can be motivating, it's perfectionism often manifests as a double-edged sword and can impact various aspects of our lives. So it's not necessarily a one size fits all concept. It's sort of broken down into three different domains when we talk about the trait of perfectionism. So, first, we have self oriented perfectionism, and this is when individuals set unrealistically high expectations for themselves. Then we have socially prescribed perfectionism, and that's when someone feels pressure to meet someone else's expectations.
Mm,
So that one's coming like sort of externally. And
mhm,
then there's other oriented perfectionism in which individuals impose unrealistic standards on those around them. So either
Mm,
you are, self-imposing your perfectionism, you're feeling perfectionistic sort of expectations from your environment, or you're projecting those perfectionistic expectations onto others. So three different
mhm.
dimensions, if that makes sense.
Oh, sure. Okay.
Yeah.
Which one do you think you struggle with the most? Mine's really clear for me.
I think probably I think probably definitely both of us deal with the self-oriented
Yes.
perfectionism where we expect we are imposing it upon of ourselves. Um, I would say too, though, I do look for the socially prescribed perfectionism. Sometimes I'm looking
Mhm.
around my environment to see if I'm good enough or if I'm meeting the quota. But I would
Mhm.
say that one's less so for me. Most of my perfectionism sort of like internal.
Mhm. That's what I was going to say. Mine's definitely self-oriented perfectionism. I don't think I have the socially
Prescribed where you're
prescribed.
looking.
I
Mm-hmm.
don't think so. I don't know.
Mm-hmm.
Maybe I do and I don't notice it, but I think I go through life most of the time thinking I don't really care what other people think. I am always caring about what I think about myself and my situation and what's going on.
Yeah, I think that rings true. And I think you have expectations for yourself that you don't place on other people. So I don't think you
Hmm.
have the other oriented perfectionism at all.
Okay.
Yeah. So the effects of perfectionism on mental health are pretty profound. So the question of where do I see it clinically come up? So if you're always striving for perfectionism or to be perfect, that leads to a lot of anxiety, obviously, but it also going to lead to feelings of depression and also burnout. So individuals with perfectionistic tendencies often experience an ongoing internal struggle, feeling dissatisfied even when they achieve success. So going back to your question, like one tried and true way to know if you're dealing with this is if you never feel those feelings of success. Like even
Hmm.
if you should feel those feelings of success and you know that that's the case, but you don't feel it and you're like, well, what's next? What's the next hoop to jump? You may
Hmm.
have some perfectionism to deal with.
This rings so true to me. I think I have such high expectations for myself and for my life that I had someone say to me one time, like, oh, you have to take a breath and celebrate what just happened. And I don't do that because I feel like when something really good happens, I expected that to happen. I had that goal for myself and I just check the box and quickly go on to the next one because there's five more ahead of that.
Yeah. Yeah, exactly. It's a never ending uh cycle, I guess, of like there's never an end in sight of what when you're done or when you're
Mhm.
finished or when you can feel happy about something that you've done. Um so clinically, I said it's associated with anxiety disorders. The ones that we see it related to are generalized anxiety disorder, which is like sort of a general excessive worry, fear about making mistakes, not meeting high standards. So that's where that would come into play. Social anxiety disorder, this would be the one that's like if you're worried about expectations placed on you from other people, the fear of judgment and a strong desire to meet others' expectations can lead to social anxiety. Um, OCD or obsessive compulsive disorder falls under the anxiety umbrella also. And so when I think about like the hallmark diagnoses that go with perfectionism, it's OCD and then it's going to be anorexia. Those are the two that really, really have high perfectionistic tendencies.
Mhm.
The other ones are, less so, but you could see it happen. So depressive disorders, including major depressive disorder, which is like when you're having a major depressive episode. That's episodic, not like, prolonged, and also dysthymia. So that is the prolonged depression that's longer than a week and, contributes to, um, low chronic, sort of low lying depression.
Mhm.
Um, yeah.
Okay, interesting. Can we go back to OCD? So I think that Um, and even taking it back a step when I asked if perfectionism is common. So I feel like a lot of women, I was going to say in our age group, but maybe just women in general, and especially moms,
Mm,
are always kind of joking about being OCD. And I see, a lot of perfectionism traits in a lot of my friends. And so then you feel like aligned, and that's just kind of normalizing the types of behaviors.
mm.
But what is exactly OCD? And when women are joking about it or kind of making it into a good thing, like I'm so OCD, I organized my whole pantry and it looks perfect, right? Like that's not really
Yeah.
OCD, right? But what it really is OCD.
So it is having an obsession. And for this one, it would be like
Mhm.
obsession with perfection. Perhaps it's obsession with being organized or being clean. And you have an obsession that you can't let go of. And I think this is where it aligns with personality is personality is persistent also. So you can have like sort of perfectionistic tendencies that fuel this OCD. What happens is you have this obsession and then you have a compulsion, and that's a behavioral response to the obsession that you have. So a lot of times you see this related to hand washing or cleaning. And so you have this obsession with, is it clean? Is it sanitized? If it's not, I need to check. And how often do you check? And so I've talked to you before too about I have issues about checking things. Especially when I'm at a high stress point in my life, I'll start checking things. And the best therapy for OCD is, even if you have that obsession, to not follow through on the compulsion. So force yourself not to check, and force yourself not to clean, and force
Mhm.
yourself not to hand wash 5 times, And so it's interesting that you see like the perfectionism especially go into OCD, but also for anorexia. You
Mhm.
see it for bulimia also, but bulimia tends to be a little bit more mood related and
Mhm.
impulsive, whereas anorexia is just having a very very strict rule about what you should look like and trying to get to that point. And it's also obsessive in a way. So you can see how the two of them would sort of go together sometimes.
Mhm. Mhm.
Yeah.
Interesting.
Hmm.
Okay. And so when um when we're kind of joking about this, like in moms groups
Yeah.
and um making light of it, that's not really helpful to the issue.
It's not. And it's like, the vernacular sort of in, if you're a professional in psychology, is to not say somebody is OCD or they are, depressive or whatever. They have depressive symptoms, they have
Mhm.
OCD symptoms. So we don't want to label each other with this either. It also sort of masks and makes light of really serious mental health problems that people do go through with OCD, and perhaps we're going through also, but just joking about it. And so
Mhm.
it's really important to, you know, uh, I guess have different language for things like that. Like, I like a clean house, or it
Mhm.
upsets me when my house is not clean, rather than like calling it like a disorder a person.
Mhm. Mhm.
That's a big like pet peeve for psychologists. Um, right. So,
That makes sense. So
yeah.
when you were sharing that it exists on a spectrum, but then it
Hmm.
also often is genetic. So is it possible to see these traits early on and then they peak, they go up and down depending on life circumstances? So if you would you possibly expect an increase in these types of behaviors if you're not aware of it and taking care of it at different points in your life?
Yes, it takes a lot of internal monitoring. So if you're noticing that this is the case for you, and you have some perfectionistic tendencies, what you may also notice is when you're really stressed out. One thing we want when we're stressed out is control. And we can have control over our environment in different ways. But again, when you want control over, often what you say, like for anorexia, for instance, a lot of times they're looking for control in their environment and they can't find it. Where they have control is their own body. And so they will control that instead. And so same thing for OCD. If you have an uncontrollable environment that you're living in or stressful environment, you may see those symptoms pop up more during those points in your life. And it's important to monitor if that's happening for you and seek help if that's the case, because there are people like psychologists like me that can walk you through how to break those obsessions and how to break those compulsions so that they don't have to rule your life anymore.
But that's a good question when you said they don't have to rule your life because um, when you first said this to me like about a year ago, I was like, oh, what even is perfectionism? And I was like
Yeah.
looking it up, and maybe this is a symptom of someone who's a perfectionist, but it feels like a lot of it's a good thing. Like
Yeah.
I do get a lot more done than others. I work really hard and I have a motor and I'm pursuing different things and I see myself as a getting a lot done type of personality.
Hmm.
So is some of that good, right? Like
Yeah.
my house is clean. My
Yeah.
things are organized. Like
Yeah.
so where is the balance, right?
Hmm.
Because
Yeah.
that piece feels a little confusing.
Yeah, so it is good and it can be bad. So it's a double-edged sword. It does the perfectionism quality does cause people to have very high rates of success. Like they are driven, like you're saying, towards completing something and they are going to, check things off of a list. It can drive individuals to achieve incredible success, but sometimes comes at a cost. So again, the cost is that excessive stress. The struggle with, often we see this, is struggle with delegation. So being able
Oh,
to share the load with other people because we don't trust that they're going to do it the way we want it done or the
oh,
the
I
best
know
way
nothing about
possible.
this. This is
Yeah.
like so foreign to me. What does that even mean? No.
Yeah. Um,
Okay, so okay,
yeah.
interesting.
So
So
it's
do
good
some
and
people
bad.
trust others to delegate?
Yeah. Yeah. I mean, so we would give like these personality traits to people who are applying for different jobs back when I was doing the business psych stuff. And it's a lookout for some people is that if they are very, very perfectionistic, they and have really high standards, they're going to have a very hard time delegating. So if you think about somebody who's going to take an executive role, you really need that person to be able to efficiently delegate and hand things
Mm,
off to other people and be able to accept B plus work, even if it's not as good as what you would have done, which was the A plus work? So
mm,
it's a lookout. You got to be like aware. It's like a red flag. And it's good to know those things about yourself because then you can push yourself to delegate more often than you otherwise would.
mhm.
Um,
Interesting. Okay.
yeah.
So this is so this is a lot to digest. I'm glad we're doing this on a public podcast. So going, I
Sorry,
kind of
Sarah.
no, I asked for it. Going back to our script because I'd kind of derailed us for a minute. So, how does it impact the daily life for people who are elevated on perfectionism but don't necessarily meet the criteria for any of the disorders that you mentioned?
Yeah. Yeah. So I think the ways that it impacts people is again, the in the professional realm, especially, it's going to cause a lot of people who are perfectionistic to have a lot of success because they're driven. I think the downside, like I mentioned, would be just not being able to enjoy those successes that you do achieve and also not being able to delegate to other people and share workloads, which just adds to your stress level and may add to your perfectionistic tendencies. It's like a cycle that feeds itself. It gets more and more
Mhm.
elevated as you continue with all of that. it causes internal struggle, especially if it's self-induced. You can really, cause yourself a lot of strife because you have an internal conflict. Like you're telling yourself all the time that you're not good enough, and that's not the case. Like there's other ways to test whether that's good enough or not, and we'll get into that in a moment. We're gonna do some reality testing.
No, no.
I know, but you can cope with perfectionism by recognizing that it's there. Number one, just identifying that you have some of that, and then adopting healthy strategies. Like I think sometimes you bring this up, and this is exactly great. Like embracing a growth mindset,
Mhm.
um, and setting realistic goals and cultivating self-compassion are going to be huge, crucial steps to sort of mitigating any sort of the downsides that we see that comes along with perfectionism.
Mm. Okay.
Hmm.
So I know you mentioned that you struggle with perfectionism as well, um, but it doesn't seem like it affects you in the same way. So how do you cope, or did you cure yourself of it? Are you able to cure yourself of it?
Yeah, I will say I did not cure myself of this. So I'd say I'm a reformed perfectionist, but by force. So one huge motto that they taught us in grad school, this grad school broke me of all of it. So I had to have perfectionism essentially to get into grad school. And then we got to
Mhm.
grad school, and the motto is assume a virtue, though you have it not, for use
Mm.
can almost change the stamp of nature.
I love
And
that.
I do too. It allows you to not have it all together before you just move. And it
Mhm.
makes you have more of a bias towards action. And I initially, like I said, I was very perfectionistic going through school. I had to have straight A's. And it was like almost an obsessive thing, but not really. I just loved to study. I loved school and I needed those A's. And I would say when we got to grad school, then those A's got me to grad school. So it's a good thing I got them. And it's a good thing I had that perfectionism. And you find a lot of people who go to grad school have perfectionistic tendencies.
Mhm. Mhm.
But once you get to grad school, you have this imposter syndrome. And so, especially as a psychologist, the first clients that you ever see, it's like I'm not ready. I haven't had enough training. You can continue to say that your whole life. You could just keep saying that same thing and never actually get started. But if you assume the virtue of I'm a psychologist and I'm going to go in there, I'm going to help somebody, then you just go do it. And
Mhm.
it turns out you can reality test a little bit and you find out that you can do it because you forced yourself to do it. And it turns out you did a good job. And the other thing that grad school taught us, and I think this should apply to most of our lives, is that once we got to grad school, those A pluses got us there, and we weren't allowed to have them anymore. If we got an A or an A plus on a grade in grad school, then we had actually not allocated our time correctly. They told us,
Really?
mm-hmm, we have to learn how to get the B because
Wow.
there's not enough time in the day to get A's on everything. And if you're going to be efficient, which you have to be in grad school, then you have to get a B, but not a C. So I think that is what broke me was learning how to get the B and making that the goal instead. It was hard. It
Wow.
was
That
hard, but
sounds
like
so hard.
yeah, it recalibrates you though. So I still struggle with perfectionism and I again lean towards those OCD type traits and don't meet criteria. But the best therapy you can do then is to go for the B. Don't clean your house as well as you normally would, but do that on purpose and see what happens. Does the house fall down? Dude, what occurs, we expect our clients to do much worse. People who are afraid of dirt, we'd have them stick their hands in trash cans and roll it around and then not be able to wash their hands. Things
Oh,
like that.
oh my
That's
God.
that's the exposure and then response prevention
What
for
disorder
OCD.
cannot do that? Because I have that.
That, I mean, if you're obsessed with not being dirty and you have OCD, that's the therapy. It's crazy, but it works. And it's basically just making yourself confront not being exactly perfect and seeing what happens. And what's the worst that can happen is the thing I say to my clients the most. And once you get there and you expose yourself to it, you'll see. So I think
Wow.
it's useful. It's good. Um, but I would say too, removing judgment helps with it.
Mhm.
So just anytime you're noticing that internal dialogue and you're noticing yourself judge yourself, which happens a lot with perfectionism, removing that judgment and turning instead to mindfulness techniques, which we've talked a little bit about. Um, and then rely on others to tell you when you need to do less. I'll bring up my husband for this one because he's often the one who tells me stop cleaning, or he'll say the house is fine, or he'll say, sit down. Like I have a hard
Mhm.
time sitting down because I always feel like there's something else that needs to be done.
Yeah.
Um, so if you're getting feedback like that from your environment, you need to take it in, which is hard for a perfectionist because we don't like criticism. But it's good information because we're getting, outside sources indicating that perhaps we're going a little bit too far with our perfectionistic tendencies. And then finally, I just want to mention radical acceptance, which is a skill from dialectical behavior therapy. I may have mentioned on a prior episode, but that's also super helpful for just accepting your environment as it is.
Okay, let's get into that a little bit because I'm really interested in it. So let's talk a little bit about what radical acceptance is.
Yeah, it's such a powerful concept, and it's a lot to wrap your brain around. But so it's essentially just accepting reality as it is. And that's hard to do. That's without changing it. And that's just looking at it as it is. It's not good or bad, but it is what it is. And you have to understand the facts of the situation, not the judgment, but the facts of the situation, both internal, including thoughts and emotions, and external, including events and circumstances. So if you're looking at the full picture and just accepting it as it is, it's actually really hard to do, but it includes like allowing and letting go a lot of that judgment about yourself and about other people, and not labeling things as good or bad, including ourselves, and emphasizing an attitude of non-judgmental observation. So it's sort of like floating through life a little bit, like just noticing what's
Mm.
going on around you without this resistance. Um, I know that this is something that people struggle with. I know I struggle with it too, but sometimes you resist environment and you try to change it. But that's not always the most effective way to handle a stressful or bad, or not bad, because that's a judgment, but a difficult situation. If you are in denial or you're resisting your current reality, you're going to be intensifying your emotional suffering. So don't resist it.
Wow.
One thing
Okay.
we talk to clients about is like, put your thoughts and your judgment or whatever it is, just place it on a conveyor belt and watch it go by. And once it's gone from the conveyor belt, it's gone, and move on from it. And it
Mm.
allows you to just like release some of those big, powerful emotions we have that are about ourselves and judging ourselves, and just allow it to pass by us and just notice it. But we're not going to take it off the conveyor belt. It's not ours. It's in a
Mhm.
box and it's going away.
Away.
Yeah. It's a
Wow.
really good, like, I don't know, way to imagine your emotions, especially the ones that are distressing. Being mindful and present, we talk a lot about that, but being
Mhm.
present in the moment is crucial for radical acceptance. It means you are paying absolute attention, full attention to thoughts and feelings without getting entangled in judgments or attempts to change them. So just allowing them to be. Um, I know it's a lot. Choosing peace over suffering is another component. So if we're going to accept, we're going to, even in difficult situations, we're going to accept. That leads to a sense of peace and emotional well-being. It's about choosing not to prolong suffering and resisting, or fighting against what can't be changed.
Mhm.
Um, So we may have, I mean, like something that's not going to change in my house, and that's not going to change in your house, is we've got lots of little kids and we like a clean house.
Yeah.
So at some point we got to let go of some of that resistance. I always think about that, the resistance to what's occurring, and just embrace the chaos in the playroom. It is what it is, and accept it. I know. It's hard.
It's so hard.
Yeah. And also like knowing what we can control and what we cannot control, and just acknowledging that. That's part of radical acceptance, is just saying, this is my reality,
Mhm.
and I'm not going to try and change it. And I don't have control over it. So why would I try to change it? We can't change anything else that's outside of ourselves, right? We can
Right.
only change what's inside. And then building emotional resilience. We talked a little bit about this before, but embracing reality without judgment. And then individuals can develop emotional resilience and cope more effectively with their challenging situations. Helps us navigate life's ups and downs a little bit better if we just watch it occur rather than sort of fight it or not accept it or be in
Mm.
denial. Yeah,
Okay. Okay. That's a lot. It's
I
good
know.
information. I have
Yeah,
two things that came up while you were speaking to radical acceptance. So,
sure.
um, I'm going to share something really personal, and
Oh,
let me see what you think about this. So,
okay.
I just like it's like a practice. I mean, it's just kind of what I do. And I think I've been doing it since I was really young, and I thought it was beneficial. But like every night when I go to bed, I just kind of have in my head, I like process the day and think about, I don't ever think about like, oh, that was such a great day. It was so wonderful and this and this. Every time I think, okay, what could I have done better? What needs improvement? Like, okay, I didn't run as hard as I could on the treadmill today at my workout class, or I lost my patience a little bit. I need to work on that, or this with my business. So I have like a process of going through and noting where I can get better, and then think about it for the next day.
Oh, sweet Sarah.
should
You're
we cut this? Should,
torturing
should we
yourself.
cut this part?
Oh, well, I
Maybe we
think
should
people
cut
can
this.
learn people can learn from that. I mean, it's up to you, but um yeah, that's a running list of judgment.
hmm But
And that's
yeah,
torturous.
in
You
my mind, I kind of saw it as like how to be successful and efficient. And I think I started doing this when I was probably in grad school myself, or even younger. And like,
yeah.
okay, like com- not competitive with others, but competitive with oneself type of behavior. But I think it's probably not.
Well, does it bring you joy?
I think no. I think maybe it's bringing me efficiencies, success. I don't know. But it's probably not, it definitely doesn't bring joy.
Okay. So I was going to assign homework, but this may pertain here
Okay.
too. Um, Try not doing that. Replace it with something instead. I think before we've talked about thankfulness.
Mhm. Yes,
Maybe
gratitude.
maybe replace it with gratitude,
Mhm.
and see if you're not as efficient the next day. Like if you took if you made a hypothesis, do you think you'd be less efficient if you didn't do it?
I don't know. I might not be as efficient. I might be happier,
Yeah,
right?
that's
I
true.
don't know.
You're also still Sarah, and my hypothesis is you'd be just as efficient without that running commentary, because you have perfectionistic tendencies. I think, yeah, finding things like that's a great example of things where have a running list of judgments. Did I do this well enough
Mhm.
today? What could I do better? Instead, maybe look at the events and look for either gratitude or look
Mhm.
for just describing your day
Mhm.
instead, like a basic. My kids went to school, I fed them a nice healthy dinner. X, Y, and Z occurred. but I like to end it with gratitudes. Like I
Mhm.
think about what I'm thankful for at the end of the night
Yeah,
for that
that's
day, and
good.
that sort of helps with the joy piece. You know, we need to enjoy life too. So,
I know.
yeah. So I would say, like, what's your other thing though? Before I go on to the homework.
Oh, the other thing is with genetics. So, um, well, I said I see a lot of these traits in my friends, and I have daughters, you have daughters,
Mm.
and friends that have boys and girls, and how knowing that this is genetic, can be genetic. Is there any way to change that, and what should we look for in our kids, and how? I mean, as I'm saying this, I'm sure you're just point the finger right back at yourself and try to like change your behavior so your children don't see it, I'm sure. But what should you do if you notice these tendencies in yourself and you have children and you don't want them to be passed down to them?
Yeah, that's a great question. It is genetic, and to the extent that our kids receive this from us, like I would hope they'd receive the good parts of it, the ones that makes them strive to be excellent, and
Mhm.
but also, be joyful and celebrate when they are excellent at something. So I would say exactly what you said. Kids learn so much from what they see. Now, I'll bring up an example. I had my favorite grandma um, growing up. She was just so special and um, close to me. She definitely had some OCD symptoms, and she had one room that must be perfect when I was growing up. So I grew up not only receiving the genetic load of perfectionism, but seeing the expression of that perfectionism on her house and on her household. And for a long time, I really looked up to that sort of behavior of having a space that's just your own and it's just perfect. Nobody's allowed inside. And if you see any footprints inside, you just got to vacuum those up and make it look perfect again. So the environment also taught me to have a perfect sort of like household.
Mhm.
And so it's not necessarily the best thing. Had she cut down on some of that behavior perhaps, or had I not grown up in a household where we were cleaning all the time, perhaps I would have less of that in my life now.
Mhm.
So where we want to break the cycle then would be for our kids, like
Mhm.
not obsessing over things like our weight, our appearance, our success,
Mhm.
over being perfect or having a perfect house. I would say, like, the more they see those things, the more they're going to internalize them. And that's just like a perfect little interaction for them of genes and environment that's going to
Mhm.
sprout into this, very organized and perfectionistic child. So, and it's funny because I do see my middle daughter. She likes things just so. The crayons must be in order and they must be color coded, and things like that I already see in her, and I love those things about her.
I know. Aren't those
um
wonderful traits in your
yeah,
child?
I know. Her
I don't see
organized.
anything wrong with this.
I know. I sort of love it at the same time, but
Yeah.
I'm like, I know for her it's important for her to see me not be critical of myself,
Mhm.
or be obsessive about things like cleanliness, because I don't want her to be overly obsessive about it.
Mhm.
So we don't want to add to the genetic load that we're sort of already giving our kids when it
Right.
comes to cleanliness or other aspects of perfectionism.
Okay.
Yeah. Did I
Yeah.
answer? Yeah.
Yeah, no, that was
Okay.
good. It's just to be aware and
Yeah.
mindful of your own behaviors, because if it's in your genes, it's in their genes, and you
Yeah.
could help sway that to be positive for them
Yeah.
if you're working on showing just the positive sides of that personality trait.
Yeah, absolutely. Like, there's research I want to say about dieting and moms who diet
Mhm.
and the effects it has on their daughters. Like,
Mm.
if a daughter knows that her mom's dieting, she is more likely in the future to have like an eating disorder.
Mhm.
Like it add, like those little things that we do sort of add to what they're experiencing and cause them to start to evaluate themselves the same way. And I know, we don't want that for our kids
Mm-mm.
either. So
Yeah.
yeah, yeah.
Yeah. It's so
So
interesting. Um,
yeah,
can I ask one more off script question?
sure.
So so in our business, so we each have our own businesses, and then we have a business together. And in our
Yeah.
business together, you do a really good job of moving quickly and not overly processing things.
Mm-hmm.
And being okay with things at a B plus, I guess, as you would say.
Yeah.
And in my other business outside of working with you, I am not okay with that. And I am constantly doing it, trying to get an A plus plus in every single aspect of the business. And I
Oh.
think that I get a lot of clients because of that work.
Mm-hmm.
And when I started working with you, it was kind of the first time of being exposed to, oh, this is good enough. It's fine. But you're very efficient because you're able to say, this is good. Let's move on. Next thing. So you're much more efficient than I am. Um, but I think about how to incorporate that in my other business and not wanting to lose the quality of the work. But how can you talk me through that and like how are you
Yeah.
able to have that mindset and where is the balance?
Well, we learn the most from just doing.
Mhm,
So I've had enough experience skirting the line of good versus not good enough
mhm,
in grad school and thereafter. Of like you can sit on a paper for years if you want to,
mhm,
and you're going to always have criticism on that paper that you're going to submit to any journal. There's going to be a lot of critical feedback no matter what you do. So you might as well submit it earlier and get that critical feedback and get it published than sit on it forever and make sure it's perfect. So I
mhm,
think it comes down to like what you said is efficiency and trying not to overthink. So perfectionists tend to overthink, and in the end it can cause procrastination. I had that
mhm,
earlier in the notes and I forgot to mention that, but it can cause people to procrastinate on making an action because you're continually reevaluating whether it's good enough. And because you're a perfectionist, it never is, so you can get
mhm,
into that mindset and then you get stuck. So as long
mhm,
as you're able to ship things, and I
mhm,
know you are because you're successful,
mhm,
um, don't lose the quality, but maybe do try being more efficient
mhm,
and getting there faster, or cutting things that aren't like prioritizing maybe a little bit different.
mhm,
Prioritize, you know, getting there fast. And
mhm,
if there's ways to do that where you're not losing a ton of quality, you're still giving quality, but you're not
mhm.
sitting on something too long either.
Yeah.
Um, I think
Not
that would
overthinking
be
it.
right. Yeah, don't
Right.
overthink it.
Mhm,
And if you're not sure, like this is what I love about what we do with this podcast and with the videos that I'm doing, is I'm throwing anything I want at the wall and
mhm.
just seeing what sticks.
I
And
know that
sometimes
makes
it's
me so
nice.
nervous. I mean, I'm texting you like, what did you just put on YouTube? That's the wrong side of my face. So,
I know.
and you're like, oh, it's fine. I'm like, ah.
I just want feedback and I want it faster. I want the
Yeah.
feedback as fast as I can get it. And I want to know what the next thing is to do as fast as possible. And I don't want to sit on something for very long. I now have this bias for action where I just sort of do stuff. And sometimes it works and sometimes it doesn't. But what I've learned
Mhm,
is when it doesn't, my world also doesn't crumble. Like my
mhm,
videos that are not successful, they don't cause me a lot of strife. I just don't care.
yeah.
For your business, it would matter to lose a client or something like that, but also consider that your B plus work is better than any other person's A plus work. Like consider that
Oh,
that's the case,
yeah. Mhm.
because a lot of times our A plus work is actually like A plus work, and then we can back it up a little bit, and maybe
Yeah.
our B plus work is actually A plus to this other client. So
Right, right.
finding that line and maybe pulling it down a little bit for yourself and
Mm-hmm.
seeing what happens. Like test it, do some reality
Yeah.
testing. And that was my homework for anybody listening and for Sarah and for whomever else is number one, if you're in California and you want help with anything like this, I'm licensed and I'm available to be of
Mm-hmm.
service. So reach out.
Mm-hmm.
But number two, is if you resonate with this trait, find one place in your life where you hold yourself to a high standard. Then deliberately do what you think is B work there. And I mean, pick it out. Pick out that thing you're going to do B work on. Do it deliberately. And because you're a perfectionist, I know you're going to get it because you're going to make sure you get it. But you'll find where that B is for that part of your life, and then see what happens. See if you get negative feedback or if no one actually notices or cares. And my hypothesis would be that little to nothing happens, and you're just going to find a little bit more peace. And
Okay.
everyone will sort of see you the same. So do some reality testing,
Mm-hmm.
see what happens. Make a hypothesis beforehand too, and then test your hypothesis. What will happen? And see what
Okay.
happens.
I'm
Yeah.
thinking.
Okay. It's a
I,
tough one.
it's really hard. There are
Yeah.
0 areas in my life where a B feels acceptable. No.
I
All
know.
the more reason. Okay. I'm going to think of
Yes.
one.
Yeah, yeah, yeah.
Okay. Oh,
Maybe you can
that's
give us like a check-in later on. Let us know how it worked.
okay. Yeah, that's a good
Yeah.
idea.
Yeah.
Okay. This was a really, thank you for entertaining this topic for me.
Sure.
That was very therapeutic. Um,
Good.
so let's jump into some takeaways. So,
Okay.
how about perfectionism is a trait that is dimensional and exists to some degree in all of us from high to low levels.
Hmm.
It can have positive and negative attributes from causing us to strive for excellence to not allowing us to enjoy our success. We can all assume a virtue.
Yes.
And then lastly, how about try radical acceptance and test your reality by doing B work somewhere in your life and seeing what happens. And so
Yes.
I'm going to do this,
Okay.
and it's going to take me a minute to decide what area because it's
Okay.
really hard to choose. But I will choose one today and I will report back.
Okay. Sounds good. I'll look forward to it.
What's the time frame? How long do you have to do this for?
Well, I think what would happen is you'd start to do B work all the time in that domain. And then hopefully
Oh,
I'd see a trickle down effect onto other
yeah.
areas of your life. That would be the hope as like a therapist. Not that you have a disorder, but usually you try to intervene on one place. And what you
Yeah.
see is after you intervene at that one place, you see it trickle onto every other domain of that person's life, which is like lovely to see. It's exactly what you want to see. But to lower the expectations systematically.
Okay.
Yeah.
This is good. This is good
Yeah.
homework.
Yeah.
Okay.
Yeah.
All
Yeah.
right. This
All
was
right.
fun.
Yay. All right, everybody. Well, that was fun. That's all for this episode of Platinum Perspective. Thanks for listening. Tune in every week for more beauty, psychology, luxury, and travel. Please tell your friends to rate, like, and subscribe. Bye.
Bye.